So Roseacre Ward is a highly specialised service for patients with personality disorder. So it's a 16-bedded ward that looks after women with a primary diagnosis of EUPD. So the hospital is located in Kent Medical Campus in Maidstone. And as you know, Kent is known as the Garden of England. So the hospital is surrounded by greenfields and woodlands. And it's a short bus ride away to Maidstone town centre, where you'll find all the amenities that you normally find in a small city.
So the MDT, as I said, is a multidisciplinary team. It consists of the responsible clinician, the consultant, the ward doctor, it's a specialty doctor. It also consists of the nurses, the clinical team leaders. It consists of the therapy team that include the clinical psychologist, the drug and alcohol therapists. It consists of the social workers. It also consists of the service users, because the MDT is about them, so they're actually part of the MDT. So we get them involved because we actually look at empowerment and getting them to make their own decisions with the MDT.
The diagnosis can be quite, complex, so it varies. The main focus is on emotionally unstable personality disorder. Nevertheless, we've supported a lot of ladies with various other diagnoses, from, schizoaffective, addiction to substances or alcohol. So pretty much most of the mental health diagnoses. There's also ladies with a history of trauma. So we look at the complex needs, not necessarily, diagnosis.
So for people with personality disorder, the recommended treatment is usually DBT. So that's dialectical behaviour therapy. So that's the main model that we offer for our residents with personality disorder. So that involves them doing skills groups and one-to-one sessions. There are 2 skills groups a week, and usually they get 1 individual therapy session a week as well. There's a variety of modules that they work through to learn various skills around regulating their emotions, coping with distress, and communicating more effectively, and helping to build more positive relationships and maybe review some of the relationships they have that might be a bit destructive or not very helpful. Our assistant psychologist also provides a variety of groups. We kind of cycle through a range over the course of the year. Twice a year we do a needs analysis to see what our residents particularly need. It involves things like anxiety management, coping skills, something called procrastination, or a group that looks at what can kind of get in the way of people getting better and making use of the treatments that are offered to them.
On Roseacre we have a lovely group of residents, many of them who suffer with various addictions, not always substance misuse. It can some ways be behavioural addictions. I generally go along a 12-step route of therapy. However, that's very much integrated with CBT, and the group work goes along the lines of DBT. It's provided in a very kinesthetic way, because not everybody learns information in the same way as everybody else. So there's quite a variation on how that is delivered. And that can be either group work or one-to-one work, depending on how many people we have and the individuals that are on the programme.
The lounge area it's a very kind of patient-friendly area, really. You can see on the walls, those are all their artwork, what they decide, what they wanted to put, what they believe could help them, what they believe could send a message for a new admission or a discharged patient. So these are messages that they put out there that they feel. And one of the things you can see about the ones on the walls, and also our own Cygnet values as well. And those are the things that we try to embed in our day-to-day interaction with patients as well as with our fellow colleagues. We have an IT service, which goes for the internet service. We have an OT kitchen, ADL kitchen as it's called, whereby the patients are being assessed in how to help prepare their own meals. We have the de-escalation room to manage acute distress. We also have the gym as well. We have a multi-faith room to accommodate the religious beliefs of needs, to cater for the religious needs for patients as well. We have the quiet room.
The aims of the service is ultimately rehabilitation of the ladies. And I think we need to be quite person-specific when we discuss about, rehabilitation. certain young ladies, or ladies, they might be able to have their own space and, have their own, go back living to their own flat, or even continue some education and work. For other ladies, I think the rehabilitation means that the quality of their life, improved, and there's less self-harming, there is that, hope of life. So I think the rehabilitation ultimately is just improving the quality of life for the ladies.
So the outcomes that I've seen on Roseacre, having been in mental health services for a long time, I think it's one of the best wards that I've kind of worked on. The staff are absolutely amazing, and we've managed to discharge so many patients over a short period of time. So I think it's testament to all the the hard work that the staff are doing on that ward.
I love human interaction. And I think, it's great to be able to talk, and even us as professionals, I think we still have that ability to learn from them. I think this is what keeps me going, the chance and the motivation to try to bring some hope in someone's life, to see them engaging and motivating and thinking and being able to plan for a better future.